Hello and welcome to Med4Care. I am Dr. Care and today's topic will be vertigo. Let's find out what they are and what are their causes, their symptoms, and their treatment. When we talk about vertigo, we have to be very careful. Indeed, in colloquial jargon this term is often used to refer to symptoms and conditions that resemble them but do not fall within the medical definition of the term. In medicine, vertigo means a sense of rotation or screwing due to a dysfunction of the vestibular apparatus. Therefore, true vertigo has a rotating character that can be objective or subjective. In the first case, the affected person reports seeing the room turn all around in a given direction, while in the second case it is as if the room were screwing around itself. Conditions without the rotational character are actually pseudodizziness and are not related to disorders of the vestibular apparatus. Among the most common we find feeling of instability, fainting, blurred vision, disturbance of ocular motility, phenomena of absence. Vertigo can be of two types, peripheral or central. The first is generally the responsibility of the ENT doctor, the second is the responsibility of the neurologist. Peripheral vertigo presents an important rotatory symptomatology, accompanied by malaise, profuse sweating, nausea, vomiting episodes, the need to find an adequate posture in order not to feel vertigo. This type of vertigo concerns the receptor or the vestibular system or the vestibular nerve. Central vertigo is most often attributed to a neurological disease. On the symptomatic level it appears milder than the peripheral one, but it can underlie more important pathologies such as tumor, vascular, inflammatory and multiple sclerosis pathologies. Generally this vertigo is linked to lesions of the connection system of the vestibule or of the vestibular nuclei to other structures of the central nervous system. However, acute cerebellar syndrome is an exception to this subdivision, since in the presence of a cerebellar lesion, symptoms typical of peripheral vertigo can occur. The most common manifestations of vertigo are persistent spontaneous vertigo, recurrent attacks, and positional vertigo. In the case of persistent spontaneous dizziness, the most frequent causes are otomastoiditis, neuritis or vestibular neuronitis, trauma to the labyrinth, infarction of the lateral bulb, and cerebellar infarction. In case of recurrent attacks of vertigo, the most frequent causes include Meniere's syndrome, Cogan syndrome, perilymphatic fistula, migraine attacks, temporal lobe epilepsy. Positional vertigo is in turn subdivided into benign paroxysmal positional vertigo, due to a contrast between our perception of the body in space and its real position, and central positional vertigo, generally due to defects or lesions of the central nervous system that prevent a correct flow of information. In particular, this type of vertigo occurs in spinocerebellar atrophies, in multiple sclerosis, in Arnold-Chiari type I malformation, in tumors of the brain stem and cerebellum. After a careful medical history, the doctor often uses some tests to identify the origin of the disease. Among these, audiological tests, tests for the identification of nystagmus, like involuntary eye movements, and a posturographic examination are often performed to assess the patient's balance. Diagnosis is also usually supported by imaging tests, such as CT and MRI scans. The recommended therapy in case of dizziness includes antibiotics, in case of bacterial origin of the problem, vestibular rehabilitation with exercises that help the brain adapt to dizziness, antiemetics/antihistamines in case of very strong and annoying symptoms. In most cases, however, there is spontaneous recovery within a few weeks or months. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon on Med4Care.